So this scan is of a middle-aged male patient who presents with severe lower abdominal pain as well as constipation. And I will browse first through the images so you make an opinion what you think the problem is. So these are the axial images. I will also show you the additional images which were required. So these images, as I'm going to browse, so you need to be more focused towards the left retroperitoneal area first. And as we browse through, you see, as I browse down these, there is now air appearing in the left retroperitoneal region, and it starts getting more extensive. And as I browse down, you can see that air is following the retroperitoneal region surrounding the left psoas along the iliacus, and it is now extending into the pelvic wall and all the way down, and is causing displacement of the rectum and the anorectal junction region towards the contralateral side. However, no significant perianal extension could be noted. And now as I browse up again, you can see that that air is tracking all the way into the anterior abdominal wall region along the right side of the pelvic wall as well. And now if you just focus on the anterior abdominal wall region, the air is again tracking within the anterior abdominal wall region, and you can just follow it up to the paraumbilical region. You can also appreciate the air here in this region as well. And these images were to show that there is no significant air seen in the scrotal wall region. If there would have been some air in the perineal region, especially the scrotal wall, and in the perineal region in this area, so then we would have rather labeled it as Fournier's gangrene, which is necrotizing fasciitis of the perineum. But as perineum is relatively spared and the air is more centered in the pelvic cavity and along the pelvic side wall, also what you would appreciate is that the air is also tracking into the left thigh as well, this region along the anterior thigh, and then you can see there are significant inflammatory changes in this region in the anterior compartment of the thigh as if you compare it with the contralateral side, and you can see fat strandings in this region as well. So this patient is more likely to be having necrotizing fasciitis of the retroperitoneum, or is known as retroperitoneal necrotizing fasciitis. I would also like to compare this axial image at the section of the pelvis to another image which is from radiographics, and this shows basically a blue colored area which is surrounding the bladder and the rectal region. So if I just follow these spaces which are in blue, so there is prevesical space at the anterior aspect, and then there is paravesical space which is along the left side and the right side as well, but you can see more prominently along this image where the air is tracking. And then there is presacral space and perirectal spaces which are also in sort of continuity with this space. This is a coronal image of the same patient and is again compared with a coronal image from the radiographics article, and this shows the potential direct communications of the retroperitoneal space through the femoral sheath and femoral vessels as well as inguinal canal region. You can see that there is a potential space, and this process is extending into the thigh through that potential direct communication routes, and the air is extending all the way towards this side. Now this is a sagittal image of the same patient, and in this image you can appreciate the spread of the infective process, which is from this retroperitoneal region all the way down through the pelvis and extending into the anterior abdominal wall and up to the paraumbilical region. So retroperitoneal necrotizing fasciitis is a medical and surgical emergency, and these are more often seen in the patients who are relatively immunocompromised. There was no workup specifically done for any immunocompetency of this patient, and these patients can also present with a variation of Cullen's and Gary-Turner sign, which is also seen in hemorrhagic pancreatitis, as these are also involving the abdominal wall regions. And in this case, E. coli and hemolytic streptococcus and Bacteroides fragilis can also cause this problem. And if you see this patient, there is also some elevation of the descending colon. If I just browse it in this area, you can see that the colon is anteriorly displaced. So could possibly be some sort of perforation, but no definite evidence could be appreciated on these imaging findings. And diverticulitis is a less likely possibility in this case scenario, as normally the diverticulitis does not normally traverse through the facial planes as in this patient, and it's more seen in the pelvic cavity rather than traversing through the pelvic walls. And so this patient of retroperitoneal necrotizing fasciitis is a surgical and medical emergency, and identifying the pathology early and reporting could help you save a life, because otherwise it has very lethal consequences. Thanks a lot for your listening, and have a very nice day.